So again, hello everyone, and welcome to the first session of the 2026 Global Collaborative Series, Global Nurse Force, Bridging Health and Climate Action. We are so pleased to have such a great turnout. We have participants from all over the world to help start this year off, and this is really exciting. So I'm Kat Kruger. I'm a PhD candidate here at the University of Michigan School of Nursing, which is organizing this series, along with Vanderbilt University School of Nursing and Yale School of Nursing. So, this monthly event is made possible through the generous collaboration of our esteemed partner hosts, Dr. Janae Marie Staccherini, a professor and associate dean for global affairs and director of PAHO and the WHO Collaborating Center here at the University of Michigan School of Nursing, Dr. April Kapu, Professor and Associate Dean for Strategic Partnerships and Global Affairs at Vanderbilt University School of Nursing, Dr. Asia Newpain, Director of Global Affairs and Planetary Health at Yale School of Nursing, and Betsy Usher, Assistant Dean for Alumni and Career Services at Vanderbilt University School of Nursing. So thank you to our partners for their dedication and contributions to this initiative. Each month we'll take turns hosting this important series, and we encourage everyone to stay engaged by registering for future sessions. So now it's my absolute pleasure to introduce today's speaker, Dr. Katie Huffling. Today she presents Nurses Leading the Way, Opportunities for Climate Action. Dr. Huffling is a certified nurse midwife and executive director of the Alliance of Nurses for Healthy Environments, also known as ANNIE. Through ANNIE, which leads the global focus on the connection of human and planetary health, Dr. Huffling works with nurses and nursing organizations to elevate environmental health issues, including climate change. She's written numerous peer-reviewed articles on environmental health issues and served as an editor on the recently released environmental e-textbook, Environmental Health and Nursing, which won the 2017 AJN Book of the Year in Environmental Health. So please join me in giving a warm welcome to Dr. Huffling as she shares her expertise with us today.
Thank you so much, Kat, and thank you so much for this invitation to be here with all of you today. This is so amazing to see nurses from all over the world coming together to talk about climate change. I feel like right now it's can be a bit of a challenging time for a lot of us, and it seeing how nurses from around the world have been coming together um, around some of the recent events has really made me so proud to be a nurse, and I um, I feel so strongly that nurses are the right folks at this time to be addressing climate change and to be coming together, working with our other health colleagues um, to tackle this, incredible challenge that we're all facing. Let me get my presentation back up here. Are y'all able to see my slides?
Yes, we
Great.
can.
Thank you. So today I'll start by kind of setting the stage, like where we are with climate change. I won't go into, a great amount of detail, but just so that we're all kind of starting from the same place, I'll be going over a number of different ways that nurses can be addressing climate change. I'll be providing a number of examples of nurses who are doing amazing work. And I hope that all of you will leave here inspired and thinking about how, whether in your personal life or in your practice, you can be leading the way in your communities addressing climate change. So, as Kat mentioned, I'm the executive director of the Alliance of Nurses for Healthy Environments, or ANNIE. We're the only global nursing organization whose primary focus is on the intersection of health and the environment. We were formed in 2008 from a meeting with around 50 nurses. They were environmental health nurse leaders, representatives from many of the national US based nursing organizations and nursing unions. And they felt like environmental health was really an important area for nurses to be engaging in, but none of them felt like they had the expertise or the staffing or the time to take the lead. And so they decided that this organization should be formed to be the leader within the nursing community in the US. And, we started out as a US based organization, but now we've grown globally, especially with our climate change work. And we work on everything from clean air and clean water, climate change, hospital sustainability, toxic chemicals. Really, if there's something related to environment and health, we're probably working on it. Human induced climate change is the largest, most pervasive threat to the natural environment in societies that the world has ever experienced. And the poorest countries are paying the heaviest price. Human rights are being negatively impacted and violated as a consequence of climate change. And it's impacting the right to life, health, food, development, self determination, water and sanitation, work, adequate housing, and freedom from violence, sexual exploitation, trafficking, and slavery. We are seeing the inaction by developed economies and major corporations to take responsibility for drastically reducing their greenhouse gas emissions. And this has led to demand for climate reparations for losses incurred. The G20, which are the largest economies in the world, for example, account for 78% of emissions over the last decade. But even though we're having this, kind of horrific challenges related to climate change, I do want to emphasize that it is also the greatest opportunity to prevent disease and to help people thrive, not just survive. And so I think focusing that is such a great opportunity for me, helps me keep going as opposed. Can you hear me now? Somehow I got muted. um, Instead of focusing just on the negative impacts, for me, I need to, kind of keep this positive frame that we do have this amazing opportunity. And we know we have no time to lose. The past 11 years, from 2015 to 2025, have individually been the 11 warmest years in the 176-year observational record, with the past 3 years being the three warmest on record. The mean near surface temperature in 2025 was approximately 1.5 degrees Celsius warmer than above the pre industrial average, according to the World Meteorological Organization. And climate change impacts a wide range of health outcomes. No matter what your specialty is, climate change already has the potential to impact the health of your patients. And as you can see in this diagram here, with the inner circle being the issues that we're seeing worldwide related to climate change, and then as you move out, those are the local impacts, and you can see the number of different health issues related to all of these different health impacts. And what I really like about this diagram is it specifically calls out mental health impacts. I think that's an area that we haven't been talking about as much as we should be, because we know, just besides the toll that mental health can take on you, it also creates a cascade of other health impacts. When you're under stress, it can put you at greater risk for cardiac issues, for other issues, as it cascades along. And climate change doesn't impact everyone equally. We need to make sure that any plans we design to address climate change has a positive impact on the most vulnerable. To illustrate this concept, I'm going to use Hurricane Irma, which happened in 2017, as an example. While excuse me, while all were exposed to the hurricane, low-income residents in many areas hit by Hurricane Irma were not able to evacuate out of the range of the hurricane. increasing the magnitude of exposure. Following the hurricane, they were without services, and a heat wave began in Florida, which had been one of the hardest areas hit. More casualties occurred after Hurricane Irma due to the heat than during the hurricane, as there was a lack of health services, no electricity, and no way for sensitive or vulnerable people to cool down during this heat wave. So, why nurses? The health center's mission is to protect and promote health. However, healthcare makes a major contribution to the climate crisis and has an important role to play in resolving it. Global healthcare climate footprint is equivalent to the annual greenhouse gas emissions from 514 coal-fired power plants. If the health sector were a country, it would be the fifth largest emitter in the world. Healthcare in the US is the second largest user of electricity, with almost 10% of all electricity generated in the US being used by healthcare. Also, nurses are systems thinkers and problem solvers. It's critical that nurses be a part of climate solutions. Nurses also know that inpatient hospital stays are getting longer as patients have gotten sicker, drastically increasing workloads on nurses. On the heels of the global pandemic, we're seeing, and many of us are feeling, the strain on nurses and other healthcare professionals. In recent years, we've also seen extreme examples of how our changing climate is putting more and more of a strain on facilities and healthcare workers. For example, we've seen nurses having a hard time getting to work during wildfires and hurricanes, and patients requiring transport during extreme weather events. As we saw just recently with the wildfires in Los Angeles, California, um, hospitals were having a challenging time. Did they need to evacuate, a whole hospital due to wildfires? These are challenges that are becoming more frequent, and so hospitals and nurses need to be prepared. And a great example of how preparedness can make a huge difference. This example is looking at Texas Medical Center. In 2001, they were hit by Hurricane Allison. Water damage to the Texas Medical Center's emergency generators and electrical switchgear caused a complete power outage. Staff worked by flashlights and ventilated patients by hand as more than 1,000 patients were evacuated from the Texas Medical Center hospital rooms and intensive care units. They incurred $2 billion in research losses alone, including computer data, tissue samples, and research animals. In the aftermath of Allison, the Texas Medical Center member institutions united in their resolve to learn from the event and invested more than $50 million to upgrade their infrastructure with resilient and sustainable design features. In 2017, they were hit by Hurricane Harvey. Due to all of the work that they had put in related to resilience, all of the Texas Medical Center hospitals and emergency rooms stayed operational throughout the whole hurricane. Environmental health is including in the nursing scope and standards of practice, in which it states the registered nurse practices in an environmentally safe and healthy manner. This can prove to be difficult with healthcare's utilization of fossil fuels for power and transportation, single-use devices and goods, toxic chemicals and materials, and planet-unfriendly sourced foods. Healthcare's multiple waste streams compound the issue further. However, we're seeing so much leadership with nursing organizations around the globe recognizing nursing's critical role in addressing climate change. They outline how nurses can include climate change in their practice, advocate for climate smart solutions, as well as training the next generation of nurses to incorporate climate change into their nursing practice. In 2025, Annie released our sustainability toolkit. This toolkit was created to support nurses at all levels, offering updated resources to get started and take action, and includes case studies of nurses driving change within their hospitals, clinics, and communities. This toolkit has been positively received since its release, and additional case studies are being added in an ongoing basis. And if any of you have examples from your own practice, we would love to hear from you to include. We really want to have a global perspective as part of this toolkit. We're continuing to share this toolkit with nursing and partner organizations and provides nurses with opportunities to create tangible actions to address sustainability in healthcare. This slide highlights the many opportunities to reduce emissions and address climate change and sustainability within our healthcare institutions. These include things like in our operating rooms with waste anesthetic gases, or shifting to less climate impacting types of anesthetic gases. Changing our IV tubing and the bags that are containing our IV fluids from those that contain DEHP to non-DEHP containing IV tubing. Looking at purchasing and reducing emissions through reduction in single-use items, as well as looking at how patients and employees travel to your healthcare institutions. And here's some examples of solutions. Over the next few slides, I'll be highlighting some of these issues, as well as nurses who are doing really amazing work to address climate change and sustainability within their institutions. I'd like to start out with Jo Bjerregaard. As the Pediatric Quality Improvement Consultant and Sustainability Lead at a large U.S. academic health system, Nurse Jo Bjerregaard recognized a critical gap in the organization's environmental accountability. They had no formal tracking of greenhouse gas emissions across their 10 hospitals and 60 clinics. She began by training staff on greenhouse gas accounting processes, ensuring that they could confidently contribute to data collection and analysis. And nurses, I think, know well about data collection and analysis. It's definitely part of our nursing process. Through their work, they identified energy consumption as their primary source of emissions. Her solution set included incorporating peak demand management, renewable energy integration, and LED lighting upgrades. To overcome financial barriers, she designed a phased implementation plan that reduced upfront costs from $500,000 to just $8,000, prioritizing high-impact cost-saving measures first. These changes led to over $150,000 in yearly savings in energy costs and have significantly reduced their emissions. Beyond metrics, the initiative sparked a cultural shift. Clinicians who had previously been disconnected from environmental issues became vocal advocates, urging the organization to institutionalize sustainability practices. As we all know, nutrition plays a significant role in health maintenance and disease prevention. Our industrial food system poses risks to environmental and human health through reliance on synthetic pesticides, fossil fuel-based fertilizers, antibiotics, and hormones, as well as low-wage laborers who face unsafe working conditions. So as nurses, we have the opportunity to be leaders in promoting a holistic approach in a healthy food system and understanding how our health and the health of our environment is related to the growth, distribution, and processing of our food. Can food services prioritize purchases from local farmers? Can the diets that we're serving our patients prioritize plant-based food choices? And we can prioritize ensuring that food does not become wasted food. We know that 30% of the food produced in the world is being wasted. The cost of producing food includes the use of water, energy, human efforts, and pollution from transportation, all of which will go for naught if we end up not consuming the food. while globally there's also a significant portion of the population, particularly children, who go hungry. Nurses can engage in home and institutional practices that help to decrease food waste and enhance food security. Matt Lindsley was one of our first Annie Nurse Fellows, which I'll be telling you more about the fellowship later in the talk. He's also a farmer and is interested in how hospitals and local farmers can work together. During his fellowship, he worked with a nonprofit organization in Pennsylvania to map farms in the state and their capacity, and then connect them with local healthcare facilities. Many of these facilities are now expanding their use of local produce and meat. It's a win-win for nutrition, the climate, and for local economies. The healthcare sector helps sustain the single-use plastic industry. Fossil fuel-based plastics have become indispensable in the healthcare system. In the US, 20 to 25% of the 14,000 tons of waste generated daily by hospitals is plastic. And a third of the gloves used in healthcare are used in situations where gloves are not necessary. An example of a campaign to reduce waste that started at the National Health Services in the United Kingdom and has been moving across the globe is the Gloves Off campaign. The use of gloves greatly increased with COVID, and these campaigns are promoting the appropriate use of gloves, thereby reducing waste and healthcare's carbon footprint. For example, the carbon impact of a single nitrile glove is equivalent to almost 4 times that of a 20-second hand wash and 10 times that of a 3 milliliter use of an alcohol-based cleaning solution. A campaign at a hospital in Quebec noted that 564 boxes of 100 gloves emit around 2 tons of carbon dioxide equivalent, which is the equivalent of a round-trip flight from Paris to Montreal. As we've been talking about hospitals and what they can do related to practice, but I think it's important to go back and look at why plastic really harms health and the environment at each stage of its life cycle. In fossil fuel extraction and transport, fossil fuels are extracted from wellheads and drill pads and transported by pipelines or rail to refineries and processing plants. Fossil fuel extraction, plastic refining, and manufacturing are highly polluting, often directly impacting the most vulnerable communities and contributing to global circulating contamination. In refining and manufacturing, through refining and crackers, feedstocks are transformed into the polymers that form the foundation of the plastic economy. Petrochemical additives are used upon the plastic resin, give specific characteristics like transparent, colored, soft, hard, flexible, giving it properties that make it impervious to light or oxygen. In consumer use, we see that during the use phase, wear and tear causes some of these products, such as tires or textile fibers, to degrade and shed micro and nanoplastic particles and fibers into the environment. Or they may leach toxic additives, such as through domestic dust and from food packaging into food. And there's some aspects which I'll touch upon that relate to patient use, like DEHP and intravenous tubing. And of course, with waste management. Life can be very short for plastic food packaging and all single-use products. All plastic products become plastic waste. In this example of waste reduction, nurse Karen Sesnak and her colleagues at the Pediatric Intensive Care Unit at Stanford Children's Hospitals formed an eco-sustainability team to identify and implement changes that would make their unit more environmentally sustainable. The team's first major undertaking addressed the staggering amount of waste generated by bedside supply carts. Each cart was stocked with over $700 worth of supplies weighing more than 17 pounds. They were routinely discarded in its entirety whenever a patient was discharged from isolation, even if the supplies remained unopened, much of this containing plastic. This practice resulted in 22,000 pounds of unused medical supplies, valued at around $1 million, being sent to the landfill annually from their unit alone. To tackle this issue, the team pursued a multi-phase approach. First, they collaborated with infection prevention control to identify 30 items in the carts that could be safely disinfected and reused, such as saline flushes that are sealed in plastic. Nurses were trained to clean, dry, and return these items to the supply closet, diverting them from the waste stream. Next, the team conducted a thorough review of the cart contents, removing redundant or seldom used items like arterial line setups. Through this process, they streamlined the carts to just $200 worth of essentials and reduced their weight to 8, down from 17. It's pretty amazing. And with plastics, it's not just plastics that we have to be concerned about. It's also the many different chemicals that are added into these plastics, as I was talking about earlier, with how they're being used. For example, most infants are delivered in hospitals where they're exposed to chemicals used in the nursing and hospital settings, particularly. For example, polyvinyl chloride, or PVC. It's used in medical products as a plasticizer for tubing and other devices. And NICUs often use these polyvinyl chloride medical products for intravenous solutions, enteral feedings, and other necessary treatments. These chemicals are known to leach out of medical devices into lipid-containing fluids contained in solutions. As reproductive and developmental toxins, these chemicals can expose infants at the time they are adjusting to extrauterine life and have immature organ systems. Due to their small size and variety of exposures, newborns in the NICU can be exposed to chemicals of concern at far greater levels compared to adult exposures. For many newborns, the time spent in the neonatal intensive care unit can be weeks or months, increasing their exposures to these hazards. Phthalates and bisphenol A, or BPA, are substances of particular concern that are often found in medical devices. Phthalates are commonly used as plastic softeners in PVC-containing medical devices, while bisphenol A is used to produce certain plastics, such as polycarbonates and epoxy resins that have applications in the medical device industry. Di-2-ethyl-ethyl phthalate, or DEHP, and PVC medical devices are commonly used. In PVC devices, DEHP could be found in 20 to 40% ratios within those devices, and they're commonly found in hospital nurseries. Health effects related to DEHP exposure include breast and other cancers, developmental and reproductive effects, including lowered male fertility, metabolic disorders such as obesity and type 2 diabetes, and negative impacts on brain development, including attention deficit hyperactivity disorders. Susceptible populations, including neonates, young children, those who are pregnant, and patients receiving cancer treatments, may face the most significant risks from DEHP exposure. There are lots of great resources for nurses who would like to address plastics and related chemicals in healthcare. Groups like Healthcare Without Harm and Practice Green Health have done a lot of research and work and worked with hospitals around the world. Healthcare Without Harm's polyvinyl chloride in healthcare details the human health risks posed by chemicals of concern associated with the production of PVC and toxic additives such as DEHP. It also explores the pollution associated with traditional methods of disposal and recycling. They recommend that healthcare facilities avoid PVC and DEHP and replace them with safer alternatives. Healthcare providers can play a pivotal role in championing the phase out by supporting substitution and inspiring healthcare communities to replace PVC where feasible and provide guidance on how to move towards non-toxic healthcare and minimize the risk to patients without compromising medical care. To give an example of how nurses have been doing some really amazing work related to phasing out some of these toxic plastics, in 2024, California passed the historic Toxic Free Medical Devices Act, banning phthalate DEHP from IV bags and tubings. This law was the first in the US and was a huge win for patient safety and public health. North Carolina followed in 2025, and nurses were essential to the passage of that bill. We also have bills coming up in Pennsylvania and Michigan. Advocates are calling on hospitals nationwide not to delay in taking action and signing on to a pledge to go DEHP. And we can really be looking to our colleagues in the European Union and some other countries throughout the world that are already going DEHP free and are showing that you can do this without compromising care and without excessive costs associated with making the switch. It's also important as we're addressing climate change to make the climate and chemical connection. Chemicals and plastic production is increasing. As demand for fossil fuel declines for energy and transportation, the oil and gas industry is expanding into chemicals and plastics. Chemical and plastic production makes up nearly domestic energy and emissions, releasing about 4 times more climate warming pollution than airlines, equal to 600 coal-fired power plants. And communities bear the burden. Facilities are often built in overburdened areas like Louisiana's Cancer Alley, where more than 150 petrochemical plants pollute neighborhoods and worsen health inequities. So, how can we use our collective power of over 5 million nurses here in the US and over 25 million globally to bring about the vital change needed? Even in areas where there's still many climate change deniers, we can help them make the connection between environment and health. For example, you can talk with your asthmatic patients about air quality decreases on hot days where we're having more of and how this impacts their asthma. You can also ask if they have air conditioning. In many parts of the world, we don't have air conditioning and nighttime temperatures are not going down, and residents are not getting a reprieve from heat. Climate, health, and equity are all inextricably connected. We now know that many of the same systems and upstream drivers of climate change and health inequities are the same. And when we look at what creates some of the greatest vulnerabilities to climate change, things like pre-existing health conditions and where a person lives, works, and plays, these are all key components to the social determinants of health. Our systems related to energy production, transportation, housing and land use, planning, and socioeconomic issues all impact how resilient individuals and communities are to the impacts of climate change. Next, I'll be going through a number of different ways that nurses have been engaging in policy and incorporating climate change into their practice. First, I'll be talking about the health presence at COP. COP is the Conference of Parties, and this is where the global climate negotiations take place. And there's a critical need for nurses to engage there on this global front. Unbelievably, it was only 2 years ago that they had the first ever health day at COP. It is crucial for nurses to have a seat at the table, as this is where the negotiations occur. And while health is not prominently incorporated into prior conference themes, more nurses attended in 2025 than in any other year. Many negotiators still do not make the climate and health connection, and they need to be hearing from nurses. And these are some of the activities that nurses engaged in while at COP. And I think it's important to note that this year's COP was kind of unusual in that for the first time, the United States was not present as part of the negotiations. And for many of us, we felt like with the Trump administration's significant pushback against climate action, that it actually was probably better that the United States was not there for the negotiations, as we think that they would have really stalled any forward momentum. And this slide highlights. Oh, go forward. There we go. Some of the many activities that nurses participated in at COP. We participated in a number of presentations, like at the WHO Pavilion. We participated in press conferences and really, ensured that the nursing voice was being heard by folks negotiating at this important event. While at COP, Annie supported the launch of the Belém Health Action Plan, which is a major commitment placing public health, equity, and climate justice at the center of climate action. It was launched with the endorsement of 30 countries and more than 50 organizations. The main objective is to strengthen the health sector's adaptation and resilience to climate change by advancing integrated surveillance and monitoring systems, accelerating capacity building, promoting evidence-based policy implementation, and fostering innovation and sustainable production. At the Belém Health Action Plan kickoff event, there was also an announcement of $300 million investment from the Climate and Health Funders Coalition. And while more funding is needed, this is a good start. Annie also signed on to the Defenders action because it was noted that there was not enough of an opportunity for Indigenous peoples to be to have their voices heard within the climate negotiations. And so we signed on in support of their rights to be closely part of the climate negotiations. There's so much urgency in addressing climate change now, but there's so much hope as well. There are solutions to the climate crisis that are achievable, economical, and will have an amazing impact, positive impact on health. And nurses are primed to lead the climate movement, and together we can ensure a brighter future. We all know the power of storytelling, and nurses have an incredible combination of skills that make us excellent storytellers. We can translate science into understandable nuggets, and we can describe what we're seeing on the ground and provide solutions. How to effectively communicate about climate change and health. You need to frame your message to connect climate and health, provide climate solutions, emphasize the health benefits of solutions, avoid doom and gloom, and know your audience. Just think a minute, like, what is your story? All of us have these stories that we can be telling, and it's incredibly powerful. Just to give you an example, several years ago, we were providing testimony about car emission standards, and a nurse from the Veterans Administration, it was her first time providing testimony. She talked so eloquently about her patients with chronic obstructive pulmonary disease and how they struggle to breathe on poor air quality days. And I have to say, the whole room was riveted. And, not many folks have that perspective of being able to describe in such powerful detail what it's like struggling to breathe. And I think that really made a difference in them ensuring that we had the strongest emission standards possible. This is Adelita Cantu. She's an Annie board member and associate professor at the University of Texas in San Antonio. For the past several years, she's worked with several local community organizations focusing on Hispanic youth to educate and engage young people in protecting air quality for a healthier community, including each student in conducting an act of leadership. This amazing group of young women, as their act of leadership, each gave a 3 minutes of testimony to the San Antonio City Council on why clean air is important to their communities. Dr. Cantu met with the council with other climate activists to hold the San Antonio City Council accountable for addressing climate change. And this is Betsy Marvel. She's a nurse organizer for the 1199 Service Employees International Union in Florida. This union represents more than 26,000 healthcare providers in 27 hospitals and 80 nursing homes. A crucial component of her job is to educate nurses in her union on issues that impact their job, and for her, this includes climate change. She uses examples in her education that hit close to home, like the number of people who are at risk of not being able to evacuate due to limitations in resources, the flooding that occurs in Miami and other coastal areas due to sea level rise, and the red tide that has started to annually hit Florida beaches and can be neurotoxic. Each year, she educates over 100 nurses about climate change and how they can make a positive difference. This is Floro Cabello. From the Philippines to Finland, he's seen how to access healthcare seen how access to healthcare has made all the difference. Realizing the impact of his own greenhouse gas emissions from long flights home, this international nurse became compelled to lead climate action efforts through the lens of sustainable development goals and health policy. Floro assisted in establishing disaster relief to help community members in desperate need after catastrophic typhoons in the Philippines in 2020. This is Dr. Beth Shank. She's on Annie's steering committee and is a former board member. She's the executive director of environmental stewardship for Providence Health System, which is one of the largest health systems in the United States. They have a goal of becoming carbon negative by 2030. She's another nurse leading the way and doing great things to reduce these healthcare systems footprint. And just to note, carbon negative is a state where an organization, country, or company removes carbon dioxide from the atmosphere, more carbon dioxide from the atmosphere than it emits. She also created the We Act framework. Through this framework, Providence is looking at waste, energy and water, agriculture and food, chemicals, and transportation. Crucially, they're looking at nurses to be a core part of their efforts as they implement measures to reduce their carbon footprint. They recognize that as the largest portion of the healthcare workforce, if they don't include nurses, they won't be successful in reaching their goal to be carbon negative by 2030. The nurse with the yellow sign is Samantha Parady, who is a nurse rock star. In 2017, they were elected mayor of Belfast, Maine. While mayor, they were able to push for the town to use more renewable energy sources, saving money and reducing the town's greenhouse gas emissions. And collective action is really important. In September of 2024, we held a roundtable at the White House Council on Environmental Quality with representatives from 26 national nursing organizations. We spoke about the health issues related to heat. And stories and life experiences from these nurse representatives were critical. We had nurse veterans, nurses who lived on Indian reservations, and each nurse had their own personal story to tell. In 2023, a number of nurses participated in a press conference and rally outside the American Public Health Association annual conference against the proposed COP City. The proposed center had already destroyed tree canopies vital to protecting these communities from air pollution and excessive heat, and the facility itself would further structural racism by militarizing law enforcement and normalizing police violence. We were asked by community members for support and used our trusted voices to speak out in solidarity for those who would be most impacted. Unfortunately, we were not successful at blocking this project, but it was, I thought, a really great example of how nurses can really listen to communities, follow their lead, and help to support those most impacted by climate change. These final few slides, I'm going to provide other ways that you can get involved with Annie and our related organizations. All are free to join. Annie has four forums: education, policy advocacy, research, and practice. They hold monthly calls. Um, for example, the research forum is open to researchers of all levels, and they provide resources, support, and mentorship for nurses interested in experimenting, researching, and tackling environmental health issues of concern. Our education forum works on an environmental health e-textbook. They also provide curriculum insertion guidelines for nursing faculty. We also have two ad hoc committees: our Global Nurses Climate Change Committee, which we would love to have all of you here on the call join, really connecting nurses, building community, and talking about what's working, what's not in nurses engaging in climate action. And we also have our Food and Agricultural Committee, talking about food systems and how nurses can be helping to reduce wasted food and be incorporating more of a holistic process with food and healthcare. We also have our Annie regional forums. We're super excited to introduce this new network. It's 10 geographically based communities across the US that brings together nurses from each region to lead, collaborate, and act on environmental justice and planetary health. And we recognize that how important, especially at these times, community is, and we're co-creating with each of these regions to create spaces for community and collaboration. We also have Annie Latin America, which also is creating amazing community and collaboration. Within Annie Latin America, we have nurses from every country in Latin America. They're set up similarly to the Annie US National, with work groups in education, policies, research, and sustainability. And these nurses are doing just amazing climate work, many in very low resource settings. And they're doing things like teaching patients about chronic diseases impacted by climate change. They're working with government agencies on vector-borne diseases, and they're training staff on disaster preparedness. In 2019, we launched the Environmental Health Nurse Fellowship Program, which partners nurses around the country with community-based organizations. By linking historically marginalized, underserved, and overburdened communities with local healthcare providers who are already part of their community, the fellowship program hopes to grow the knowledge and skills of both the nurse and working alongside community, and also the community-based organization in environmental health. This program serves as a model to health professionals' partnership with local communities to improve health equity, promoting community empowerment, and advance global action on planetary health. The first example here is a project is with Mia McPherson, who worked with a climate resilience hub in Detroit, Michigan. They recognized that many residents in their community did not have air conditioning and didn't know how to stay safe during extreme heat waves. Mia developed a toolkit for community education and outreach and continues to work with the Eastside Community Network on emergency plans tailored to the needs of the community. This second example is Hannah Noel, who worked with students in the heavily polluted area of North Charleston, South Carolina. The students learned about pollution in their neighborhood and participated in climate and community-centered storytelling. Her work continues to support the next generation of climate leaders. We just started our fourth cohort of nurse fellows, and applications for the fifth fellowship will open this fall. Currently, it's only open to US-based nurses, but we're currently looking for funding so that we can expand globally. So fingers crossed, we're able to get funding. We actually had close to 20 applicants globally this year, and we were really disappointed that we weren't able to include them in the fellowship. As I had spoken about earlier, we have a free environmental health e-textbook. It has a whole chapter on climate change with lots of great science and tips on how to engage around climate change. Please join our mailing list. This is how you can get news on the fellowship and other ways to engage with nurses around environmental health. And I just wanted to close with an update on something that's coming out, we hope on Earth Day. Um, Stu Hassmiller and I are editors on a book titled Taking Action: Top 10 Priorities for Nurses to Protect Health in a Changing Climate, that's being published by Sigma. All of our proceeds from our royalties from the book will be donated to Annie. And we're hoping that this will be something that's really inspiring for nurses around the world. It has a global perspective. Thank you so much for having me with you today. It's been a real pleasure. And I'm so excited about the work that nurses can be doing globally to address climate change.
Thank you
Thanks so
so
much.
much, Dr. Huffling. That was a fabulous and very informative presentation. So now we'll go ahead and stop the recording and open the floor to questions and